From the Center for Family Health. We have clinic manager Tracy VanBuskirk and lactation counselor and RN Nikki Sorrow. Good morning.
Good morning.
Well, we were just talking about
Women's health.
women's health.
Yeah.
Women's health. So that's our theme today.
That is.
And that's one of the things Dr. Don was saying. People that are pregnant need to get all kinds of things done right away, early on.
Mm-hmm.
Testing and
Yeah. What are some of the women's health services that you all offer?
Well, in preparation for coming on the show, Nikki and I had spent some time together talking about some of the things we want to talk about, and there's so much with women's health. We have so many services. We had to try to kind of narrow down some basic ones. Obviously, the newly pregnant person will need to come in and talk with our nurses and get the information for their pregnancies. Then we have lab work that's done. And Nikki, if you want to speak to some of the traditional labs that we do.
Yeah. So in the beginning of their pregnancy, women will get a lot of testing done. So we do like the routine STI testing.
Mm-hmm.
We test all the blood work, the complete blood counts. And we do an ultrasound in the beginning, and then we follow up with more labs towards the end of the pregnancy as well.
And when people, as soon as they find out they are pregnant, is that when they should start getting the tests and start seeing their
You can even maybe even come for a pregnancy test.
Yeah, so what we do when someone is pregnant, they come in for a pregnancy test, and then we get them set up with what's called a nurse intake. So they either meet with one of the registered nurses or the medical assistants, and we like to do that around 8 to 10 weeks. And then we order all their labs. We can draw their blood in the office, or they can go downstairs to our lab. And then we also order the ultrasound, get all that done first trimester, and then they meet with one of the providers.
And this is the office. Beautiful office.
That is our nurse intake room. We just recently updated that. We're pretty proud of that.
And you have, is it 6 OBGYNs as part
In
of
office
that?
right
Wow.
now, yes.
Wow, that's awesome. Amazing.
I remember when our town, I think the whole town had just,
Probably not even
Not
6
even
at
that.
one point, yeah.
and it's typically, it's good news. It's happy news when a family hears that, but it might be a very stressful and a surprise for moms that discover that. They might have several children and it might be stressful, but you also there's mental health services.
Yep, so for every single intake, we have a community health worker come in and then also a behavioral health coach. They talk with the patient, they give them a lot of resources that Jackson has to offer, and they can meet with them anytime they come in for a prenatal visit. They're always available and ready.
What about after the baby's born?
Well, you're welcome, because we have a fantastic pediatric department also. They do follow with us initially with their postpartum needs, but then we try to get them a tour down to our pediatric department if they're new to the center, to introduce them to some doctors if there's some available, and then the staff that's down there as well. So that it's basically coordinating care for the babies, and with Nikki being a lactation counselor, she also works with our pediatric RN as well with new moms coming in if they didn't deliver with us, to meet with them and get the babies started as best they can.
Let's talk about that a little bit. That is not easy. It is not a one size fits all for women and babies, correct? And it can be very, very frustrating.
Yeah, I like to say breastfeeding is unnaturally natural. It doesn't come easy for a lot of moms, and that is totally okay. If it's your first time, if it's your third baby, every baby is different. So I really love just helping moms be able to form that connection with their baby. So I can help with any latching issues, if they have questions about storing their breast milk, even if they want to wean their baby off at like a year. Really any breastfeeding, lactation questions. I'll meet with the mom one-on-one. I can do it over the phone, however best fits for them. And
it was really more of a concern with the formula shortage, though.
Oh yeah.
Is it better now? Is it more available?
Yeah, it is better. It is better now.
The center is available to anyone, and there's not just one location, but you can see people everywhere. For OB/GYN and prenatal services, do they go downtown?
Yes, anything for the OB related will just be at our downtown office, but as for other women's health services, if they are just use their annual PAP or have any questions, we have the 4 school health center sites as well as we do see patients at Lifeways as well.
What about teen pregnancies? Obviously, we do see those in town. Same services available?
Yes, same services are available, and sometimes there's family issues there, so we do some services confidentially.
Sure.
Based on the child's age.
Okay.
So.
During a 9-month pregnancy, how often do you recommend that moms to be see a doctor or practitioner?
So the first trimester, they're seen every 4 weeks. Obviously, if they have a need to come in, we will see them. And then once they're in their second trimester, they're seen every 2 weeks. And then their third trimester at 36 weeks, they come in weekly. We really want to monitor them closely. And then if they're high risk at all, we will do NSTs with them, non-stress test. So we hook them up to the monitor and monitor the baby closely as well as the mom. So then they come in a little bit more often for that. So about twice a week if you're high risk.
And when moms to be come in for the first time, particularly first time moms, is this when they make the decision of who's going to deliver their baby, who's going to take care of them, who's going to even take the care of the baby after he or she is born?
Yeah, so like we were talking about, we have 6 amazing OBGYN providers, and we like to have the patient see all the different providers, in case one of the doctors is on call, at least they know that provider. But if they really connect with one provider, they can pretty much see them throughout their whole pregnancy. We just encourage them to see them all, so it's not like, hey, I'm here to deliver your baby,
And I bet the OBGYNs want the same experience, to be able to meet all the moms to be.
Yeah, it's really nice to be able to connect with your doctor and then the doctor to connect with the patient, and then you have that bond.
And I'm sure people have tons of questions when they come see you. Easy to get questions answered, of course, when you call the Center for Family Health.
I think so, yes.
Yeah.
I definitely think so. We have a pretty vast staff in women's health, so if we can't get you immediately, we're calling you back very, very shortly, because it's can be a scary time.
Right.
Yeah. Did we have a baby boom because of COVID?
We were just talking about that.
Is it real? Did it happen?
Maybe
a little.
Yeah,
maybe a little.
We go through for our nurse intakes, that's where we see for the first time these pregnant women, and some weeks will be boom, 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 well, on to the next, and then so it kind of fluctuates.
Are you a mom yourself?
I am not. No.
Are you, Tracy?
Yes, I have a lot of children. I have 3. It looks like a lot.
A lot.
I think anything more than 1 is a lot, from what I've experienced.
It feels like a lot.
All the school-based health centers are now open, and
Yes.
so we're seeing everyone at all your locations.
Yes, we're very excited to finally just be open, be able to see everybody in the community.
Nice. Well, we appreciate all the Center for Family Health offers our community, particularly for moms to be and new moms, and great to hear about the services you offer.
Great, thank you.
Thank you
Thank you so much.
We love to come on and talk about it.
Awesome.
We'd love to have you here. And this is Nikki's first visit on our show, so you'll come back.
Come back?
If
Okay.
you'll take me,
Oh,
I will.
of course, we have more questions.
Nikki Sorrow is an RN and lactation specialist at the Center for Family Health, and Tracy VanBuskirk is the clinic manager. More of the morning show after this.